I do this work because I want to support the women who look like me, the women who I once was, who struggle with feeding their babies and making sure their babies had healthy starts. I do that so that they don't have to come across all the challenges and barriers to being successful, however they deem success to be. As an IBCLC, International Board Certified Lactation Consultant, there aren't many of us. There's a little less than 19,000 IBCLCs in the United States. Probably about 2% of those are Black or women of color. And so when you go into WIC clinics and agencies, most staff are not reflective of the communities that they're serving, which presents a challenge when you're trying to provide education and support, especially in terms of understanding their unique challenges and barriers. We have women of color going back to work as early as 10 days postpartum. That is a barrier and a challenge in itself and leads to poor health outcomes and poor life expectancy.
I feel that the need to bring an equity lens into the projects, into research, into policies, into everything that we do at the local level is very key. And there's still a lot of work that needs to be done because the times that we're living are unprecedented and challenging. So the need for health equity has never been more important.
Personally, I feel like my job is the most rewarding in WIC just because I get to really interact with our participants on a personal one-on-one basis that I feel good about, and I hope my participants do too. I feel like it is always a need to be out there working with WIC just because people do have some food insecurities and moms have insecurities about breastfeeding. And so I feel like we are filling in that gap of helping them to find that security that they're looking for with food and with breastfeeding.
I was grateful for that because even after I had my second daughter, I was making a career change at that time and finances were kind of crazy. So at that point, WIC really helped me in making sure that I knew, what resources were there.
So I think now we're looking at it more at a microscopic level, making sure people still have access to remote services, that we're doing phone support, we're doing virtual support, whether that's using Zoom or Google Meets or whatever the case may be. But also a lot of WIC clinics are getting out into the communities and going into the hospitals where families are and where they need the most support.
I think it's important for new mom and existing mom to have access to diverse choice and most importantly, to be educated on how to choose. Just having the choice is not enough. Knowing what each choice involves and what you are really choosing is very important. And I think we can do that.
WIC has the power to ensure that the nutritional needs of mothers and infants are met. If we're being more inclusive in our approaches and equitable in our hiring practices, then we'll attract more folks who are reflective of those communities and will ultimately lead to better health outcomes for our families.